All right, Lisa. This is Lisa and Liane, her daughter. Liane is 16 years old. So I talked to you on the phone today, Lisa. Why don't you tell me why this bill is important to you and your family, your daughter?
Because my daughter has a syndrome that's going to last her the rest of her life. Without the SCHIP, I don't have any way of insuring her. My employer only insures me and not her. I make too much money for her to be on Medicaid.
When you say too much money, how much money, I mean, if you don't mind sharing, how much money do you make?
I make $10 an hour. I'm hardly middle class, and I was told that I can't gross more than $1,800 a month to qualify for this insurance.
So that's just barely over the, I mean,
Right.
poverty line's about $15,000, so you're making
About $20,000.
about $20,000 a year. And how much would Liane's health care cost if you didn't have SCHIP? Do you have any idea?
I haven't priced it lately.
But it was more than you could afford on $10 an hour.
Yeah, it would be $800 to $1,000
a month.
Yeah.
Okay. And that would be out of pocket, or that would be you probably couldn't even get insurance because she has a pre-existing condition.
Right, and that's the other thing is these kids need to stay insured because of the pre-existing condition. If they lose their insurance, then they can't. If they pick up insurance at a later date, they will go without coverage because of a pre-existing condition. So it's very important that they don't have a lapse
So
of coverage.
if this bill would pass, one of the things it would have done is raise the level of income that you can make and still qualify for the program, right?
Right.
So that would have obviously, that would be important because that would allow you to be upwardly mobile a little bit. You can make more money because I assume right now the way it works, if you got a better job, it wouldn't be worth it to you because you would lose the SCHIP coverage for your daughter.
Right, unless I could find a job that had insurance. But, I mean, I lost my good job 3 years ago. I've been having to work temporary and contract positions. And the jobs that I have been applying for that are full-time, they don't offer benefits for families. And that's part of the reason why there's a greater need for this.
What would you tell Joe Nolenberg if he was standing right here today next to you? What would you tell Joe?
Well, actually, I called him.
And what is his response then?
He pretty much is mimicking what the president has said on television, that it's not true. I mean...
Are they calling this socialized medicine, basically, those kinds of things?
Right, but it's... I don't know what other options people have that are in a situation like me, and this gives me the opportunity to advance myself. If they take it away, then what's my option? Quit my job and go on welfare so my daughter can have insurance? I don't see how that's beneficial.
Right. Okay, well, thanks. Appreciate it.